Hello, good evening friends. I am Neeraj Kumar Kathal and you are watching For Nurses Preparation YouTube channel. Today we are discussing a very important health related disease condition, that is hypertension. I know you are familiar with this disease condition very well, but today we are presenting this disease in a very short manner for quick revision as a point of view of upcoming nursing exams 2021. So, in very easy words, we can say hypertension is a condition in which person's blood pressure is more than normal or increased blood pressure for a persistent long time known as blood pressure. Let's see its definition and let's begin our today's video. Hypertension definition: persistent elevation of systolic blood pressure, at the level of 140 mm of Hg, and diastolic blood pressure at level of 90 mm of Hg or higher in average adult on three separate readings recorded several weeks apart. We will discuss this definition. You have to focus upon the points which are underlined in this definition. In our body, normal blood pressure is 120 by 80 mm of Hg. This 120 value known as systolic blood pressure, systolic BP or upper BP, and this value 80, this is the lower BP or diastolic BP. So if in a adult person, average adult person, we check BP in gap of few weeks 3 times, if his systolic blood pressure is 140 or more than 140 mm of Hg and his diastolic blood pressure 90 mm of Hg or more than 90 mm of Hg, known as hypertension. I am repeating this definition again. In an average adult person, if we check BP on 3 separate occasions with a gap of few weeks, and in the reading we found systolic blood pressure 140 mm of Hg or more, diastolic blood pressure 90 mm of Hg or more, this condition is known as hypertension. Next point, hypertension is also known as silent killer or silent killer disease because it can damage vital organs like heart, blood vessel, kidney and brain slowly without pain. Hypertension is also known as silent killer disease because it can damage our vital organs like heart, blood vessel, kidney and brain and more without pain. You can take a screenshot for your revision. Now let's talk about the important signs and symptoms or clinical manifestations of hypertension disease. First is headache. A person who is suffering with hypertension may complain regular headache, and headache mostly occurs into the occipital region. This is the back portion of the head. This is known as the occipital region. Second is dizziness. Dizziness is a similar term that means vertigo, or person feels that he is having fainting, he is feeling unstable, he can fall. Such feeling known as dizziness. Next important symptom is palpitation. Palpitation is a condition in which heart beats irregularly and faster. Person can feel his heartbeats. This condition known as palpitation. Flushing. Flushing means redness of the skin, especially in a hypertension patient on the face and neck region. Next is blood vision. Blood vision or double vision may be present because eyes are mostly affected in this disease condition. Dyspnea may also be present. Dyspnea means difficulty in breathing. Other symptoms may include it. As we previously told that hypertension is known as silent killer. In start of this disease condition, person is not having any kind of symptom, but slowly this disease develops into the body, and in a stage suddenly he shows his symptoms, and at that time various body organs are damaged. So be very uh, attentive if you have such symptoms. Now let's talk about the diagnosis of hypertension disease. How we can diagnose the person is having hypertension or not. First, by taking history and physical examination. If the person says that he is having following symptoms or few of them, then we can say the person is having or may have hypertensive situation. After that, hypertension affects the many organs and systems of the body, so we have to take care of those organ and systems also. So precaution wise and to confirm the actual cause of hypertension, we can do sudden test like renal function test. By this test we can obtain functioning of the kidneys. In renal function test, mainly serum creatinine level, blood urea nitrogen level is tested. We can also check electrolyte imbalance, because if the sodium level is high in the body, it is directly proportional to the blood pressure. Sodium level increases, it leads to high blood pressure. For precaution wise, we can also evaluate the blood sugar level in person's body. Hypertension mostly affects the cardiovascular system, in especially this system, heart. So to get information about the heart's actual condition, we can perform or check electrocardiography, ECG. After that, we have to check the lipid profile in body. What is the level of HDL, high density lipoproteins, LDL, low density lipoprotein, and as well as what is the level of cholesterol in the person's body. Cholesterol is an important component of our cell membrane. If its level below 200 mg per dl, it is good for us. If the level rises, this cholesterol can cause many serious heart related problems. Hypertension can cause serious complications and organ damage. In heart, myocardial infarction and heart failure may occur due to hypertension. In brain, stroke may be present. Kidney diseases, even kidney failure, renal failure also may occur. Eye related problems, even person can blind due to hypertension if not treated properly. You can take a screenshot for your revision. Now let's talk about the management of hypertension condition. We can manage hypertension by three interventions: lifestyle modification, dietary modification, and pharmacological interventions. In lifestyle modification, we encourage patient to control his body weight according to body mass index. It is seen that obesity is related with hypertension. So we have to encourage person to maintain his body weight according to body mass index. Avoid alcohol and smoking. Regular exercise is also needed. Dietary modification. We encourage patients to take green vegetables and high fiber diet. Limit sodium intake during the acute phase of hypertension. Pharmacological interventions. To remember the drugs that are used in the treatment of hypertension, remember this mnemonic A, B, C, D, V. A stands for ACE inhibitors, B beta blockers, C calcium channel blockers, D diuretics, V vasodilators. All these five group of medicines are mostly used in the treatment of hypertensive situation. ACE inhibitors, beta blockers, calcium channel blockers, diuretics and vasodilators. You can take a screenshot for your revision. Thank you so much friends for watching this complete video. All the best.